Okay, Assalamualaikum and good afternoon. So our group want to present about article review about musculoskeletal injury management or prevention approach for disabled athlete on spinal cord injury. So for article review, we choose six article, which is first, effect of inspiratory muscle training on exercise responses in Paralympic athlete with cervical spinal cord injury, and second, pelvic floor muscle training in spinal cord injury and its impact neurogenic destruction of activity and incontinence. For third article is respiratory muscle training in athlete with spinal cord injury, and the fourth article is benefit of an exercise wellness program after spinal cord injury, and for the fifth article is effect of 12 weeks rebound therapy exercise on static stability of spinal cord injury patient, and last one, cooling strategy improve intermittent sprint performance in the heat of athlete with tetraplegia. And for introduction is spinal cord injury is defined as a damage to the spinal cord which influence the patient's ability for standing, walking and doing their daily activities. The main complications associated with spinal cord injury are inability to stand and walk, bed sore, bowel and bladder impairments, digestive system problems, muscle spasm, joint deformities and bone osteoporosis. To decrease the complication is to undergo various therapeutic strategies, including the use of various orthoses to stand and walk, physical exercise to increase the range of motion of the joint and to reduce deformity, and the use of functional electrical stimulation.
Next, we move to the objective. For the first article, the aim is to investigate the effectiveness of inspiratory muscle training (IMT) in highly trained Paralympic athletes with cervical spinal cord injury. For the second article, the aim is to investigate whether 6 weeks of regular pelvic floor muscle training can reduce neurogenic detrusor overactivity (NDO) and incontinence and improve the strength and endurance of voluntary pelvic floor contraction in incomplete spinal cord injury. For the third article, the aim is to investigate the effect of resistant muscle endurance training (RMET) on the respiratory function and exercise performance in endurance athletes with spinal cord injury. For the fourth article, the aim is to describe the initial benefit of structured group exercise program on exercise frequency and intensity, perceived health, pain, mood, and television watching habits. For the fifth article, the aim of this study was to evaluate the efficiency of using rebound therapy, which is exercise on a trampoline, on SCI individuals' static stability. For the last article, the study was to assess whether pre-cooling or cooling during exercise enhanced repeated sprinting performance in the heat of athletes with tetraplegia.
Okay, next we proceed to the methodology. For the article 1 stated that 12 athletes with motor complete cervical SCI injury level C5 to C7, American Spinal Injuries Scale A or B volunteered to participate in the study, and the participants were paid by the International Wheelchair Rugby Federation, and then they randomly assigned to an experimental group which is inspiratory muscle training or a placebo group. Both groups completed 6 weeks of the intervention. Okay, for the second article stated that two male subjects, which is 53 years old and the 64 years old, the difference is the one did not take anti-muscarinic medication and voided on urge, but the other one is the was on anti-muscarinic drugs and clean intermittent catheterization of four-bladed emptying. And the program consisted of the 40 PFM contraction divided into 4 sets. 3 sets for prolonged contractions and the other 1 set for the short contraction. Subject need to do 3 times daily in different positions, which are laying down, sitting, and standing if possible. For the second article stated that 9 endurance athletes were evaluated on 3 occasions with 1 month interval between evaluations. They perform between T1 and T2 their standard individual exercise and training program, which is control group, and between T2 and T3 the same program with 5 additional RMET sessions per week. Each evaluation included lung function tests, respiratory muscle strength and endurance tests, a maximal incremental arm cracking test, and field tests. Ventilation and dyspnea were evaluated during each exercise test. Next is for the fourth article, stated that 89 persons with SCI participate voluntarily in a no-cost twice-weekly physical therapy group exercise class over 3 months. 45% completed pre- and post-participation interviews on exercise frequency and intensity, perceived health, pain, mood, sleep, and television watching habits. For the fifth article, explained that 16 people with SCI that had classification into A, B, C, and D were randomly assigned to experimental group and control group. This exercise program lasting 12 weeks and the period of the rebound therapy exercise is between 10 to 30 minutes for 3 sessions a week. The exercise that included is sitting without hand help, jumping, and upper limb workout in the sitting position, core stability training in lying position which is plank, side plank, curl up, bird dog, and 2 persons exercise in sitting and lying position. Lastly, the article explained that the study using 8 male athletes with tetraplegia performed intermittent arm crank exercise. The trial involved a no cooling control, pre-cooling, or cooling during exercise. Okay, next I will pass to my friends for the next presentation. Thank you.
Okay, the result for first article. After 6 weeks of intervention, the inspiratory muscle training group shows significant increases in diaphragm thickness and PI max compared to placebo. Thus, inspiratory muscle training resulted in significant diaphragmatic hypertrophy and increased inspiratory muscle strength in highly trained athletes with cervical spinal cord injury. For the second article, both of them show significant changes in strength and endurance. Subject 1 scores 81% in NDO suppression, 118% in PFM, and 17% in modified Oxford score. Meanwhile, subject 2 scores 16% in NDO suppression, 114% in FPM, and 17% in modified Oxford score. However, only subject 1 was reduced in continence, scoring only 17% in ICIQ-UI. For the third article, no changes in lung function and maximal inspiratory strength, while maximal expiratory strength and respiratory endurance increased from testing 2 to testing 3. During the arm cranking test, exercise duration and maximal power output were slightly increased at testing 3 compared to testing 2, while ventilation and dyspnea remained similar. During field tests, exercise time and ventilation were unchanged, but dyspnea was reduced between testing 2 and testing 3. For the fourth article, mean participant age of the respondents was 43.82 years. 49% had AIS-C or D injuries, 24% had AIS-A-B paraplegia, 9% had AIS-A-B C1 to C4, and 18% had AIS-A-B C5 to C8. 75.6% of participants were male, and 84.4% had traumatic etiology as the cause of their SCI. There was a significant improvement in days of strenuous and moderate exercise, as well as health state. There was an average decrease in pain scores, depression scores, number of hours spent watching television, and days or week of mild exercise. For this fifth article, the result after 12 weeks, the control group had no progress, while the experimental group that in rebound therapy exercise had a significant improvement. The mean value of stability parameters is decreased during the exercise program, which is 37.8 mm before exercise and 20.6 mm after the exercise. For the sixth article, result both PRE and DUR cooling strategies improve the ability of the athletes to repeatedly perform high-intensity sprints with times to exhaustion (TTE), whereas during the CON trial, athletes demonstrated a reduction in the total number of sprints and TTE. Core temperature was significantly higher for CON compared to PRE and DUR. Rating of perceived exertion and thermal sensation upon exhaustion or completion were not different.
Okay, now we move to the discussion for the first article to investigate the effectiveness of inspiratory muscle training. Trainer Paralympic athlete. Okay, they're using a placebo-controlled experiment design. Okay, in the 6 week of pressure threshold IMT resulted in significant increase in diaphragm thickness and without significant effect on lung function. Okay, among wheelchair rugby player homogeneous. Okay, for the second article about basic pelvic floor exercise, actually can reduce the activity of neurogenic detrusor, increase the strength and endurance of voluntary pelvic floor contraction. Both subjects presented with comparable level of neurogenic detrusor, similar autonomic dysfunction with an upper motor neuron lesion. Okay, for the third article about RMET, resistant muscle endurance training, increase expiratory muscle strength and respiratory endurance without significant effect on IMT and also not affect the lung function variable. Okay, RMET did not increase significantly exercise duration and maximal power output during the maximal incremental using cranking test. Okay, during field exercise test, reproducing a specific resting condition and reduce perception of dysphonia but not modify that performance. Okay, we move for the fourth article about the group exercise class. able to receive access to appropriate equipment, skill therapy supervision, personalized exercise program development, and mentorship designed to promote their wellness. Okay, participants become a society partner in the education of our trainers, while the trainers gain actually a valuable clinical experience working with the person with SCI. Okay, next we move to the fifth article about rebound therapy influence. This rebound therapy influence can influence the cardiovascular performance, mental health, quality of life, also influence the amount of oxygen consumption while walking, and also exercise. Rebound therapy influence the also static stability among all the adults. And also for the hearing and vision impairment, also improve the stability of the such patient with SCI. Therefore, it is recommended to be used also for paraplegic subject. This is one of the SCI injury. Okay, for the last discussion, for the sixth article about pre-cooling and during exercise cooling strategy, prologue. The ability of the athlete to repeatedly perform high-intensity sprint when compared with the no cooling. This study has shown that pre and during strategy can improve the duration and repeated sprinting capacity in athletes with tetraplegia. This is also one of spinal cord injury involved.
So, for the recommendation of our article review, for the first article, inspiratory muscle training RMT has the potential to improve inspiratory muscle structure and function and to influence the exercise response in highly trained athletes with the cervical spinal cord injury. Thus, the researcher has suggested the IMT should be included in the training. For the second article, pelvic floor muscle training is proven to treat the bladder dysfunction of spinal cord injury even in 6 weeks. The program consisted of up to 40 pelvic floor muscle contraction divided into 4 sets, so 3 sets of prolonged contraction and 1 set of short contraction. It is recommended to do 3 times daily in different positions such as lying down, sitting and standing if possible. For the third article, RMET, which is a respiratory muscle endurance test, is considered as an attractive intervention since it can improve the respiratory muscle function, respiratory sensation, and exercise performance in spinal cord injury patients. For the fourth article, for person with spinal cord injury, participation in structured small group exercise class show promise for improving regular exercise participation and increasing exercise intensity will be important for all individuals with spinal cord injury. For the fifth article, rebound therapy is good to adding in an exercise it has since it has potential to increase the muscle strength, body balance, bone mineral density, and heart level, and serve a useful tool for all parts of the body. This exercise is useful for those with spinal cord injuries and others wheelchair-bound people such as older adults. For the sixth article of our recommendation, for our last recommendation, the cooling vests have shown to reduce thermal strain in athletes with tetraplegia when used during a 20-minute pre-cooling period and during exercise. It is recommended that athletes with tetraplegia performing intermittent sprint exercise in hot conditions should use PRE or DUR to improve performance, but the specific technique should match the power output characteristic of the event. As a conclusion, all the articles are using exercise training to treat the complication of spinal cord injuries, such as the rebound therapies, were used to improve the balance, while the inspiratory muscle training and respiratory muscle endurance were used to improve the respiratory function. The recommendation above will improve patient strength and also can prevent the other complication happen during and after spinal cord injury. So this is our reference. Okay, that's from us. Thank you.